Okay.
Hey guys, thanks for clicking onto our extended video. This video will go more in depth about diabetes. Diabetes is a chronic health condition. There are several types, including type 1, type 2, and many more. With around 90% of the cases, type 2 is the most common type and will be our focus for this video. People get type 2 diabetes when there's a lack of insulin in the body. Made by the pancreas, this is a hormone that carries glucose in the cells to give us energy. When there is a lack of insulin, there is an excess of glucose in the bloodstream, causing diabetes. According to the Hong Kong Hospital Authority, as of late December 2021, there are 700,000 people with diabetes in Hong Kong, meaning that 1 in 10 people suffer from the disease. So, what causes diabetes?
Let's begin with the physical factors. Genetics can affect how your body makes insulin. Being overweight or obese can also cause insulin resistance. This means that the muscles as well as liver or fat cells do not use insulin properly, resulting in blood glucose levels to rise. Excess glucose in your liver or your blood that is not carried into the cells are turned into fat cells, replacing liver cells over time. This develops into fatty liver disease and heightens the risk for diabetes.
Furthermore, bad communication between cells and broken beta cells also means that the body can no longer produce enough insulin to regulate a person's blood sugar level, causing diabetes.
Next up, let's discuss the social factors. One of the biggest reasons that people develop diabetes is their access to nutritious food. Many people lack sufficient resources to manage this condition, such as income, education, and suitable housing. A study has shown that individuals with lower income and less education are 2 to 4 times more likely to develop diabetes than more advantaged individuals. And of course, poverty is a core reason too. People who are rather poor suffer from material deprivation, which means a lack of resources to meet the standards of health. To provide for their families, they constantly work to make ends meet, which results in high levels of chronic stress. Moreover, self-destructive behaviors also contribute to the leading causes of diabetes. Excessive alcohol intake, consumption of unhealthy foods, all increase the likelihood of obesity and being overweight. Some negative consequences of allergistic load include increased blood pressure and blood glucose levels. Lifestyle factors such as dietary choices, physical activity levels, and access to primary healthcare services also impact the development of diabetes.
Next, we are going to look into how cultural perspectives has an impact on diabetes. Diabetes can be influenced by one's religion. To begin, different religions such as Buddhism and Hinduism lead to a diversity of diets, meaning that there are different risk factors for them. Religious beliefs can also impact how patients cope with the stress of diabetes, as people might be unwilling to switch from the lifestyle that they have grown up with. Furthermore, in many families, cultures and religions are fostered within, causing individuals to grow accustomed to it, making it more difficult for them to change their habits, even for the sake of preventing diabetes.
Now, how well do you know the traditional Asian diet? Most of you guys probably eat white rice daily, as it is our staple food, but its high glycemic levels actually double the risk of type 2 diabetes. In Japanese and Chinese cuisines, we tend to add a lot of soy sauce and salt. For the average Asian, we take thousands more milligrams of salt than our body should take. On the good side, though, our diet contains many cruciferous vegetables, or veggies of the cabbage family. These include your favorite cauliflowers, cabbage, broccoli, etc., and they're great for lowering the risk of various diseases. Soybeans are also a popular ingredient, seen in our local Hong Kong-style soy milk, as well as tofu and soup, which help decrease blood glucose.
Then, what do you think of diabetes? Do you feel like it's something that can be ignored or isn't important? Your beliefs and attitudes towards diabetes can also affect its development. Some people who are religious might believe that their illnesses are in God's hands, which means they are less likely to change their lifestyle, even if it could cause them harm, leading to a higher risk of getting diabetes and harder treatment. Other than that, people who believe that diabetes wouldn't affect their life will also refuse to change their habits, as well as ignore warnings, leading to them getting diabetes easily and ignoring treatment advice. Even if you don't have diabetes, your beliefs can affect other people around you who do have it. For example, the common misconception that diabetes is purely caused by a person's choices and actions can lead to ignoring other factors like obesity or factors related to someone's body size or weight. Even though stigma like this could be because you want to help the person with diabetes, it could lead to the opposite effect.
The development of diabetes has a strong relation with family history. If you have any family members that currently have diabetes, you are more likely to have prediabetes, which later develops into diabetes. People who are more likely to get type 2 diabetes have had gestational diabetes, are overweight or obese.
Different groups of people certainly affect those who are at risk of diabetes. To begin is your age. It is shown that children who are overweight or obese due to their habits or show insulin resistance from a young age or have biologically related relatives in high-risk ethnic groups have higher chances of being diagnosed with diabetes. Next is that people in different social groups receive unalike treatment due to their financial ability. The IDF Diabetes Atlas 9th edition 2019 states that 3 out of 4 adults with diabetes live in low or middle income families, demonstrating how this disease is more common in developing countries who might not have access to good food, diet, or healthcare. Diabetes.org states that in 2011, 2,059 USD were spent on diabetes in Hong Kong per person, in comparison to Bangladesh, with only 27 USD spent. Sevington's research states that both obese men and women have reduced physical and vitality scores compared to normal weight individuals. It also mentions how women feel more impacted and overwhelmed by diabetes compared to as women experience more body pain and physical impacts compared to men.
Now, how does diabetes actually affect our body? Diabetes can cause nerve damage. You might lose your sense of touch or even movement in the legs, feet, arms, hands, chest, and stomach, as well as any nerves connected to the body organs. If diabetes is managed poorly, it might even result in severe impairment. Eyes are at a risk of blindness, and there's an increased risk of tooth decay and skin infections. Nerve damage in the feet can even cause clogged toes and structural foot problems. Not only is kidney disease more likely, but people with diabetes are 2 to 4 times more at risk to die from a heart attack. The moral of the story is diabetes is detrimental to almost every part of the human body, and this can massively impact your life.
Moving on to the social impacts. When an individual is experiencing symptoms of high or low blood sugar, this decreases their productivity at work and makes them unable to generate income to support themselves, placing a strain on family members to provide financial assistance. Furthermore, as a result of the individuals growing anxious about monitoring their blood sugar levels, weight, and diet because of their disease, they could develop depression or anxiety. It could also be caused by rapid changes in mood due to changes in blood sugar because of diabetes. As for the economic impacts, diabetes is regarded as one of the most costly medical conditions worldwide. In Hong Kong, the annual total cost for diabetes is around $14,000 to $16,000, with the government covering approximately 78.4% of the costs. Moreover, the bills for the associated costs of treating diabetes, such as medication and insulin injections, are very costly.
Lastly, how can we prevent diabetes? First is our diet. We should incorporate more vegetables and fruits into our diets as they give us vitamins and minerals. You can also find healthy fats in olives, nuts, and fish, which should be eaten instead of saturated and trans fats. Remember to be mindful of your diet and cut down on sugar, saturated fats, and salts, as they can increase our risk for developing this disease.
Second is exercise and lifestyle. We should exercise more regularly, maintain an active lifestyle, and build good habits to decrease our chances of getting diabetes. Thank you for watching our extended video, and we hope that you learned more about diabetes.